Welcome to Adapt NCLEX Maternity. As part of health promotion is a big portion of your exams. Today, we're going to talk about preeclampsia and antepartum hemorrhage for nursing. Are you ready? Let's get to it. 10 questions, I yield NCLEX practice question. First question, what do you think? This is a strategy to approach every maternity question. Go back to the last statement of the question. That's what I call it. Read it from the back and then find out what is the buzzword, put it together, and then find the answer. All of the questions, that's the way I'm going to approach it. And you should stop the video and do the same thing. That's the best way to benefit from this video. What is the priority nursing action? I put priority there. And nurse is assessing a 1 hour after vaginal delivery. That's the client. The uterus is what? Boggy and deviated towards the right with heavy lochia. We have a bunch of things going on. What is the next priority action? Number 1, administer oxytocin. 2, insert the folate. 3, massage the fundus. 4, notify the healthcare provider. What do you think? Stop the video and select an answer, lock in your answer, and then let me know. You can put it in the comment. But what do you think should be the right answer? I'll give you a few seconds to think about it. Have you locked in your answer? If you have, this is the way I will approach it. I'll go back to the question and figure out what is going on. They say priority action means others are okay, but you got to pick one. Which one? How do you decide? Patient is 1 hour after delivery. Okay. And what is going on? Uterus is boggy. This is abnormal. Deviated towards the right. Why? Because of the bladder. The bladder is full and the uterus is deviated. That's the problem. The uterus is big, boggy, and deviated towards the right because the bladder is not allowing it. The bladder is full with what? Heavy lochia. The patient is bleeding. What would you do? Stop the bleeding. Which of this is going to stop the bleeding? Pitocin require an order. We want what? An intervention that can occur right away. It will take time for pitocin to work. Even if you have an order, it will take some time. Insert the folate. I know a lot of people will choose that, but that is the wrong answer. Why? Inserting the folate is going to what? Empty the bladder because the bladder is full and displacing the uterus and preventing it from contracting. Yes, you put the folate catheter in, the bladder decompressed. The uterus still needs to what? Decompressed or need to contract. You have done nothing. You have now allowed the uterus to what? Contract. But the patient is already bleeding. Do something. It's okay to put the folate catheter in. We will do it. It's not the priority. Even though you can decompress the bladder and allow the uterus to become midline, it's still boggy. Something need to push it. Therefore, what we do, fundal massage is the best way. It's the non-invasive. You don't need anything. And we'll call the doctor later. So that's the wrong answer. As you can see, the right answer is fundal massage. This is Adapt NCLEX questions for my QBank. It is the way I usually break down the question for you to understand. Next question. Which client is at greatest risk for postpartum hemorrhage? A prolonged labor with high-dose pitocin, preemie gravida with spontaneous labor, vaginal delivery at 39 weeks, and a newborn weighing 6 pounds, 2.7 kilos. Who is going to bleed? The one that uterus is going to get bigger, multiple gestation, prolonged labor. Those are the one. A 6-pound baby is still not big. It's not microsomia. 9 weeks getting close to what? Post-term, but still, it's still one single baby, not multi-gestational. This is your first baby. Still, you have spontaneous labor. You don't get pitocin or anything like that. We're good. But if you have a prolonged labor with high-dose pitocin, more likely to get uterine ethylene, therefore this patient is going to bleed. Which nursing action is the most important for a client with severe preeclampsia? Go over the buzzword, underline it, connect it to the dot, and then figure out what you think. This is a common sense test-taking strategy. Keep the room brightly light. Limit visitors. Encourage frequent position change and part side roles. Think about it. I want you to lock in your answer choice. And let me know what you think. For number 3, which action is the most important? All of them are okay, but which one would you do? Go back to the question and tell me what is the most important thing in the question, and then use it to answer the question. Most important, I mean severe preeclampsia. What am I worried about? Seizure. Which of this will help you with the seizures? Of course, keep the room light. Bright is going to make the patient have more seizures. Living visitors is okay. Encourage frequent position change. That may be okay. At least put the patient in a position that will help when the seizure happens. Bad rules. When you have seizures, you prevent injury. So that's the right answer. Is that what you choose? I know you choose that because that's the most important answer choice among all 3 over there. A nurse is caring for a client admitted with severe preeclampsia. Which action is the priority? Initiate magnesium sulfate infusion, place the client in the left lateral position, administer pitocin, monitor fetal movement once per shift. What do you think? Stop the video, lock in your answer, and let me know. Or you can put it in the comment. What do you think? Patient has severe preeclampsia. What do you do? This is the way I approach it. And this is the rationale I'm going to give you. You have severe preeclampsia, priority. That means all of this is good. What do I prevent? Seizures. That's what I'm worried about. Does magnesium prevent seizures? If you pick that, next time, don't pick it again. It depends on the question. Look at the question. I know a lot of people will pick this. A lot of people will pick this, but please don't pick it again. Read the question. You see, it said what? Severe preeclampsia. And the priority, I need to prevent seizures, right? I need to prevent seizures. That's what you will do. Let's look at number 2. Place the client in the left lateral position. Which one do you think you should do? It's a priority. Which one do you think is the most important? Administer pitocin. Pitocin, we're not initiating contraction right now, so that is good. Gone. Monitor fetal movement once per shift. It's not going to be what we do. You got to monitor the patient more frequently. And therefore, we left with answer choice a lot of people will pick. Between give them what? Magnesium sulfate and put the patient in a left lateral position. This is the key. Write this down. When you have severe preeclampsia, there is no blood flow to the placenta anymore. The blood going to the placenta is decreased. You get vasospasm. And vasospasm, these lead to placenta insufficiency. If you have never heard it before, insufficiency, that means there's less blood flow. So the most important is to allow blood flow to go to the baby. How do you allow blood flow to the baby? Put the baby mother in the left lateral position on the left side. This take the uterus off the compression of the inferior vena cava and allow more blood, improve the blood pressure going to the baby, not the mother. Then we can initiate pitocin. At the same time, NCLEX require you to do things that are non-invasive. Which one is non-invasive? Hey, magnesium, you're going to get it. It's going to take some time. But the easiest things you can do is to put the mommy on the left side. If she had seizures too, yeah, she's already on the left side. She's on the left side, she get more blood flow to the baby. We're good. Left lateral position, initiate magnesium infusion. Those are your answer. Therefore, we're going to choose that as our answer before we initiate any magnesium. I know this may be a little bit challenging for you, but this is the way you approach questions. And this is the rationale. Like I said, the same thing. Severe preeclampsia causes vasospasm and decreased ureter placenta perfusion, putting both the mother and fetus in immediate weeks. If you place them on the lateral position, you improve blood flow, right? This is the first nursing action before you can initiate magnesium for seizures, right? And nurse is caring for a pregnant client at 34 weeks gestation with preeclampsia. Same thing. Which assessment finding is most concerning? That means all of them are concerning, but which one? They have protein in their urine, face, edema, blood pressure, elevated, severe right upper quadrant pain. Locking your answer, like I said, to benefit from my videos, always stop the video, answer it yourself, and then we break it down. Let me know, what do you think? You can put it in the comment, but how would you approach it? What will be your answer? Think about it. The first thing that came to your mind, what was your answer? Don't guess too much. Go to the buzzword and say, most important. That means all of them are right, but I got to pick something that is going to save the patient. 34 weeks, preterm, right? You have severe preeclampsia. I'm worried about you. I got to prevent seizures, right? But what do I see? 2 protein plus is the definition of preeclampsia. Facial edema, definition of the preeclampsia. Blood pressure, definition of preeclampsia. The question says most concerning. You have right upper quadrant pain that has developed into what? HELLP syndrome, elevated liver hemolysis, elevated liver enzymes, and low platelet. That's HELLP syndrome, severe form of preeclampsia. We should intervene. We should worry about that. So I'm worried about this. Number 6, and then she's caring for a postpartum client with heavy bleeding and hypertension. The same question we saw at number 1, but change the information. You see the content changes based on the keywords in the question. That's the buzzword. Patients postpartum, bleeding heavily, and hypertension. Fix the bleeding. Which intervention should the nurse perform first? Check the hemoglobin, give the IV fluid, massage the uterus, prepare for blood transfusion. Which answer choice will you choose? I put these questions very critical to let you think. As you saw, and next, the new nurse test plan, usually these are the way they want you to think, escalation of care, and therefore you have to figure out critical judgment. What is going on in this critical thinking strategy? Patient is bleeding and I have hypertension. I got to fix the problem. Preparing to give blood is not a priority. I'm not doing anything. I'm prepared. If I massage the uterus, it will take care of the problem right away. IV fluid is just filling in the tank. I know what is bleeding. Patient is postpartum, heavy bleeding, hypertension. Most common one is what? Uterus. Go for the uterus. Checking hemoglobin in the patient who is hypertensive, you don't do anything. Which postpartum finding require immediate intervention? Fundus firm and the umbilicus, lochium, rubra for 2 days, saturating a peripad in 50 minutes, mild uterine contraction during breastfeeding. What do you think? Which one would you pick? Is the fundus and the firm and the umbilicus? Well, umbilicus is the earliest place they can be. That's check. And it's firm. That's check. I'm good. Rubia, 2 days is okay. Peripad, saturated 15 minutes. I'm worried about you. If you're breastfeeding, you're going to have uterine contraction. And therefore, the right answer is peripad contraction. These are little things I want you to pay attention to when you answer your question. Go and attack the answer choice and break it down. Okay? A client with severe preeclampsia at 36 weeks asks why early delivery is being discussed. Which response by the nurse is most appropriate? Why do I need to deliver you? Because you have preeclampsia. You are 36. You're almost close to term. Blood pressure medication will control the condition. Is that appropriate? Delivery is the only definitive treatment. Bed rest will prevent complication. Magnesium sulfate cures preeclampsia. What do you think? What do you think? Magnesium sulfate cure preeclampsia. Is that true? Which answer choice do you pick? Blood pressure, does not control the condition. It controls what? The blood pressure. There's so many things associated with preeclampsia. Blood flow to the placenta is the big problem. That's why they can have placenta abruption. Delivery is the only means. Bed rest does not prevent complication. This is no placenta previa. And then magnesium sulfate does not cure. It just prevents you from having seizures or progressive in your way. Therefore, the right answer is for this. And next note, what? Continue heavy vaginal bleeding despite firm uterus. Despite firm uterus, you still bleeding. Which cause of postpartum hemorrhage should the nurse suspect? You see, uterine atony, retained placenta fragment, bladder distension, uterine inversion. Which of these causes bleeding despite you having contraction? What do you think? That is the key. What do you think? I made a video on bow tie question specifically for this. And you should watch it. The bow tie question, same thing, you bleeding despite the firm uterus. Uterine atony is not going to be firm. That is eliminated. Bladder distension, the uterus is not going to be firm. Uterine inversion, what? The uterus is not going to be firm. Therefore, retain fragment. And the last one is a long one, but to let you think critically. Which finding does the nurse recognize as the most likely cause of client vaginal discharge? This is let you think critically as you go through the nursing process. Think about it. It's a long one, but it doesn't matter. A nurse is assessing a pregnant client at 39 weeks. That's all. Who report what? Passage of small amount of thick, right? Blood thin mucus and experiencing irregular mild uterine contraction. The client denies abdominal pain and fetal movement is present. Is this placenta abruption, uterine rupture, placenta previa, and blood show? If you see questions like that, they give you a bunch of information, go for the buzzword, put it together, and you'll be able to get the answer choice easily. Let me know which answer choice you pick, lock in your answer, and let me know. But what do you think? Is the placenta abruption? It cannot be placenta abruption. You're looking for what? Painless vaginal bleeding. The patient denied pain. Off. Uterine rupture. The buzzword. Cessation of what? Uterine contraction. The patient is experiencing mild uterine contraction. That's not it. Placenta previa. They're going to have what? Painless vaginal bleeding. Even though this partner pain is, they don't have pain. This is what? Blood, thin mucus blood. They are not bleeding. This is a bloody show. This is Adapting Class. Thank you for watching. 10 questions on preeclampsia and what? Antepartum hemorrhage to test your knowledge. If you need more, check Adapting Class and follow our maternity series. I have a playlist with a bunch of maternity questions. You got to master it. That's what is showing up. You have to know maternity and newborn. Good luck and best of luck.